Welcome to Town Hall TV. I'm Nigel Allman. I'm absolutely delighted to welcome Dr. Imran Rangzeb to Town Hall TV. Imran is the driving force, the proprietor behind Town Hall. I'm absolutely really interested, Imran, in how you've actually developed Town Hall into what it is today. So tell me a little bit about it.
The journey has been a long journey, Nigel. I think we're 8 years now into having the clinic. For me, I started off my practice in Halifax Town Centre, and we were there for a couple of years. It was a small setup, and I always had a vision of developing something bigger, but it really was location, space. They were the two main things at the time. That were the factors, and where we're going to open the practice up. This building came available, and it was actually a family member of mine who purchased it for their own sort of business interests. Unfortunately, that didn't come to fruition. And he basically offered it to me, and he said, would you be willing, do you want to open a practice, and you can sort of buy the building off me, you can have it. And looking at sort of at the time, looking at the size of the building, it was a bit daunting, and I just sort of sat on it for a good 6-12 months, as I don't really fancy taking this project on. However, at that same time, I'd started my implant training journey, and I realized where I was working, it wasn't really suitable, to attract that sort of clientele. And I felt there was a need for something just a little bit more different. And in my mind, having done a lot of sort of training, a lot of courses, I felt one of the big things that was lacking in practices was a customer experience. There's many great dental practices, many great clinicians, but I think now the time that we're in, everybody's looking for an experience. It's not just about the product, it's actually how you receiving that product as well. So that was really the thought process when we moved into here, is even though there's 4 private practices within the vicinity of this clinic, for me it was how can we be different to the other clinics, and I felt what we do differently to everybody else is that patient journey, is that patient experience. So the patient journey, for me, I feel is one of the most important aspects of patients receiving treatment. And what I really worked hard on developing was the team and understanding the importance of customer service and how to deliver that customer service in this environment. And I think if you look at the awards that we received over the years, that's testament how well my staff do in taking care of our patients.
Thank you, Imran. Really interested in, you've built this business, you are filling this building, and you talked just a moment ago about how daunting it was to take on the building in the first place.
Yeah, now we don't have enough space.
Now you're running out of space.
Yeah.
And you're running out of space because you're continually evolving what the practice does. Can you just explain a little bit about Breathe for us and the next new venture for you?
I'm not sure if you're aware, but a couple of years ago we ended up working with Leeds United Football Club, and currently we're the official dentist to the team. About 12 months ago, one of the players came in for his routine assessment, and he showed me that he was wearing this special dental appliance, which I had not come across before. Okay. And I'd like to think I know most things in the field, but that's something that was completely new to me. He'd basically received this treatment by a dentist in the US, and the idea was it was going to help with his breathing and his airway, and ultimately his posture, and hopefully maybe helping him improvement in his playing career as well. In order to be able to take care of him and look after him, because he was actually flying out to New York every 4 weeks to have this appliance looked at and adjusted, which was obviously very difficult for him. So I contacted Dr. Belfer, who's a developer of this appliance called the HomeoBlock. And I subsequently did some training with Dr. Belfer. Now, since that training, this appliance, this HomeoBlock appliance, actually become very famous, because it's been mentioned in a book by James Nestor. The book is called Breath. I believe a lot of people read this book, and we're getting many clients coming from all over the country, literally contacting us for this specific treatment, the HomeoBlock. Now, for me, after completing the HomeoBlock training, I felt there was more to this, that I need to learn more. Just doing a few days training on an appliance wasn't enough to be able to offer a comprehensive breathe assessment stroke treatment for people who are suffering from these conditions. So I reached out to Dr. Zaghi, Dr. Suresh Zaghi, who runs the Breathe Institute in California, Dr. Zaghi is an extremely intelligent individual, okay? And what really attracted to me was his background and his CV. And his CV basically, he's done his medical training at Harvard. He did his specialist training at Stanford. And the person who's trained him for sleep medicine was the father of sleep medicine, a chap by the name of Professor Christian Guilleminault. Now, he was the one who invented this whole science back in '76. And this Dr. Zaghi is his #1 student. And he's basically carried on with his research. So for me, it made sense to sort of follow that sort of person. Now, since our relationship with Dr. Zaghi and the Breed Institute, this whole concept has evolved even more. We're seeing a lot more adults, a lot more children, where we're getting comprehensive assessments for sleep and breathing disorders in conjunction, in support with the Breed Institute in California. So yeah, so it's early days, but the future is so exciting, and yeah, I can't wait until lockdown is over. So because we have many patients from Europe who have contacted us who want to come for this treatment. So yeah, the future looks very exciting.
It's exciting to be a small part in this journey of yours. One of the things that struck me early on was the corporate social responsibility. Yes. So your desire to be part of the community. Just tell me a little bit about how important that is to you.
The corporate social responsibility part, for me, it's actually core value of my belief system more than anything. And that's where it stems from, the need to help the community. We've always been taught, and this really, for me, comes back from my religion and the teachings of our Prophet Muhammad. And it's always about giving and helping those around, doesn't matter who that individual is. And you know, honestly, Nigel, previously I'd send a lot of money to Kashmir, okay, to the families there, or I'd send it to Palestine. I'd donate a lot of money to people in war-torn areas. But when I was actually reading some work of the Prophet Muhammad, and what he said is that you should help those who are on your doorstep. And that's when it dawned on me. I was like, there's so many people within our communities who are struggling. They are more deserving for us to help and support. And that's when me and Rachel sat together and we launched this whole, how we're going to work within the community, starting with things like just offering dentistry to those people who are not able to access dentistry. Then from there, working with mental health organizations, working with people in disability, being able to support those, working with the homeless, being able to support their dental needs. And then we realized there was also a big need in the area of actually feeding people. So there's our sister sort of charity, Focus for Hope, that looks after almost 200 to 300 food parcels a week within our community. So from starting a couple of years ago with an idea to today, where we're delivering 200 to 300 food parcels in the community on a weekly basis. We've done 8 trips last year to Calais, not last year, sorry, the year before, 2019 to Calais. That's something that we do regularly as well. So this whole charity side of thing is what is the real passion. Okay, the dentistry allows me to do that. I always used to, in all honesty, I previously, before sort of moving into Brighouse, if I was doing any charity work or giving any charity, it would normally go to families in Kashmir, sort of where my ancestors are from. And only until recently, I was reading some works of our Prophet Muhammad, and he said the importance of the money they give to charities, to give it within the area that you're in, to look after those people. And after speaking to my manager, we realized actually there's a huge need within our own communities, as opposed to sending money abroad, as well as many people are struggling in all parts of the world. But our duty is actually to take care of those on our doorstep first. And that's really where the CSR work then started from, where currently we provide 200 to 300 food parcels within our community on a regular basis, on a weekly basis. And we started this just as sort of the first lockdown started, was announced, and that's just ballooned. I believe we are I think we're the only charity within Calderdale that's doing this level of work, which is an honor really, which is great that we're able to support and help people, and we're able to be an avenue to do that. And then the dental side is working with homeless people, working with those people who can't access dentistry, those who can't afford dentistry, trying to help and support those. So just really just doing as much as we can to give back to our community that we're from.
I think it's an incredible story, and what's really great is we're at the beginning of that journey, in one sense. So the opportunities that are presented both from a clinical side but also from a corporate social responsibility are enormous. Imran, it's been an absolute pleasure talking to you. Thank you for your time.
Thank you so much, Nigel. Nice meeting you. Thank you.